Hi, I'm Emily Griffey, the Chief Policy Officer at Voices for Virginia's Children. And if you're someone like me who is worried at night about how kids are dealing with the pandemic, or if you're any kind of advocate for children, then you need to be an advocate for children's mental health right now. We need you to join us this legislative session to lift up these issues about children's mental health and well-being. We know that before the pandemic, 1 in 4 children in Virginia experienced a mental health issue. And during the pandemic, we think that there's been about a 9% increase in youth, at least 11 to 17, who are concerned about their mental health issues. After the pandemic, when we come back to regular life, we really don't know what things will look like. We do know that the pandemic comes on top of childhood trauma for many kids in Virginia. At least 20% of kids in Virginia have experienced 2 or more adverse childhood experiences. And beyond that, many kids have also experienced racial and historical trauma. Our mental health systems need to be prepared to respond to trauma of all kinds. That's why moving forward, we hope that the legislature will support parents in the role that they play as their child's first teacher and a buffer for their own mental health. They can do that with additional economic supports and home visitors. We hope that folks will ask questions about mental health starting early, training early educators to respond to social emotional needs and building response systems like early childhood mental health. We hope that the legislature will look at leveraging Medicaid, because right now 1 in 3 kids in Virginia is enrolled in Medicaid or FAMOUS, and Medicaid can fund services across a variety of systems, from our public mental health system to our education system to our private clinics. And we need to look at funding this entire continuum of mental health supports, both the prevention side and the deep end services. Finally, and most importantly, our mental health efforts must apply an equity lens that includes widespread training to meet the needs of children of color and respond to racial and historical trauma, and to incentivize a diverse workforce to serve children. I hope that if you are a children's advocate, you will also join us as an advocate for children's mental health during the 2021 session and raising these issues of what is so important for children in our Commonwealth moving forward. Thank you.